Linda.
Hi, I'm Lynn Behringer. I'm a professor and director of the Center for Adolescent Nursing at the University of Minnesota. I'm also president of the International Association for Adolescent Health. And I'd like to speak from a life course perspective. I'm hearing you talk and others, Jeannie, this morning, talking about, being on a life course of healthiness. And speaking from an adolescent health perspective, we know that a pregnancy can, supported in the right way during adolescence, there's a little window of opportunity where a young person might be saying, I want to make something of myself because I realize I want to be a good parent. And last weekend I was in rural Wisconsin and watched in a restaurant obese parents struggle to get their 2 twin toddlers out of the high chairs in the restaurant. I grew up in a home fortunately without obese parents. We biked, we hiked, we skied, we backpacked. That was our lives. My husband was in a family with an obese parent, and beginning very early on, they ate dinner out, they went to movies, and they watched TV. And I think that we might be missing this motivation around, like we do with young people who are pregnant and we want to keep them in school, around wanting to be fit for parenting. Fit for parenting so that those parents can be active with their children and that they can, so I think the questions about what is it that you dream of doing with your children as they grow up, as being part of the motivation. Now, so that's one question I have, and I just want to speak from the perspective of a public health nurse who's been in probably thousands of homes of pregnant and parenting, mostly teens. Do they have a scale in their home? And maybe we should turn this into a sticker that goes on the scale so the guidelines are literally at their feet.
Oh, that's very nice. Anyone want to?
Well, I'll just make a very quick response to that. I think you're right on target. If you want to deal with diet and life balances, it starts with the parents. It starts in early childhood. It starts in nurturing. However, the issue is you have to start the change somewhere. And the only captive audience that you have is a pregnant woman, because when people are pregnant, that's the only time most people get care. So if you can change them during pregnancy, hopefully you can maintain that for the rest of their life. And I think that's why this is very important, because you got to start somewhere. But you're absolutely correct.
I guess I just respond. I totally agree with what you're saying. I think our programs often in public health are somewhat categorical and focus on the reason that client's there, which is unfortunate. I think in our division of public health, within Women's and Children's Health, we formed a group to look at how our programs together can focus on the life course. And we're in the early stages of doing that, but we feel very excited about integrating that perspective into all our programs. Because then I think when adolescents come into our clinic for well care, we'll start having those kind of conversations with them. And we won't look at them as there for their adolescent visit or their school health visit or their athletic, permission to participate in athletics. We'll look at it as an opportunity to help them look at their life course and what they want. And what is it that we need to do for them and with them to get them on that course. I think we're in the early stages of doing that as programs within public health. I think it's very exciting, and I think it's the kind of opportunity that will get us all out of our categorical, why are you here for family planning? Well, we're not going to talk to you about what might happen if you're pregnant, if you're here to prevent a pregnancy. Well, we need to. And so I think part of that life course perspective is to kind of integrate that philosophy to providers in all our programs. And I think then we'll be more successful at doing what you described.
And I would just
Next
say,
slide.
you know, we do have this big gap in care that still exists and between the pediatric and the now I'm pregnant. And really the reality is that just so many women haven't been seen since they were a little kid. And so while it's super important to get to them before they get pregnant, the reality that we're faced with as providers on the ground is that we are going to miss that preconception period for a large percentage of the population, period, end of story. It's just the way it is right now, and I'm hopeful that, you know, changes in the system will make that a smaller percentage. But I agree that we have this moment of opportunity when folks are pregnant, but I think the biggest issue is that there just hasn't been real education, especially I'd like to see us link more with the pediatric provider population, the nurse practitioners and doctors doing care, and to really talk about, let's prepare these young girls with the knowledge of what they're going to need to know moving forward. Whether, you know, they just don't know that they need, what is a well-woman visit? They, you know, simple things like I need to go and take care of these aspects of my well care as a young adult female. They're just the gaps there huge in what young girls know. And so I think that the more we sort of work towards focusing some education on that period, along with the other pieces that we need to put into place, which is fitness for adulthood and pregnancy. I think those are great concepts.
Okay, next question. This will.
Cheryl Curvin, clinical dietitian. I just had a comment about WIC. WIC, as we know, provides a great service in making, you know, healthier foods available to these pregnant women. But I do think it's an excellent opportunity also to do nutritional. Technically, the registered dietitian's job at WIC is to do a nutritional assessment. In practicality, from what I've seen, they have about 5 minutes to work with the family. They say, okay, you're eligible for more benefits, here's your card, and you're on your way. I think they spend a little bit more time with babies and children. They'll get the babies and children weight, and they'll chart them just to make sure that they're, you know, moving along the scale the way that they should. But that same attention on the physical and nutritional assessment, I think, isn't done with the mothers. I understand why, because of the time constraints. But again, we're looking at ways, how can we best capture pregnant women's attention. I think WIC is an excellent opportunity to do so. There just needs to be, I guess, some help in removing those barriers to make that time, you know, make that time more valuable, since it is, you know, and they also, you know, women that come into WIC, they bring their families too, of course, and so I think it's also an opportunity to do that family counseling that we've been talking about, is trying to integrate the family into the total picture of how can I improve my health, and, you know, I'm coming to WIC not just to get food. I'm getting healthy food. Well, why am I doing this, and how do I incorporate that into my family life? So I just think it's a good opportunity, and there needs to be more discussion on how to make that work within the WIC framework.
Okay, we have time for a brief response.
I would just say that I somewhat disagree. I would say it depends on the WIC program, you know, itself. I would say that we actually encourage our WIC program staff to spend a fair amount of time with a pregnant woman, doing exactly what you said, and having that conversation about what she wants and what she needs to, or she's interested, she feels she needs to change, and doing that in the context of her family and her abilities. One of the reasons why we support breastfeeding, for many reasons, but it allows the woman to participate on the WIC program herself for 1 year postpartum. And that gives us an enormous opportunity to continue to have conversations about moving to a healthier weight during that period. And we in our state have really emphasized that opportunity, and through our policies and our quality assurance reviews, look to see that happening in our clinics. So I think it's variable. I don't think it happens exactly the way we intend all the time, but I think that we're working really hard to encourage the practice that you suggested.
And I just want to add a quick plug in for the importance of the provider having the conversation with the mom about the breastfeeding and the extra year and continuing on WIC. Because so many moms see their friends, once they have the baby, they go and they get WIC formula for their baby. And you really have to actually have the conversation with the mom that, do you realize if you if you breastfeed during your postpartum period that you will get a year's worth of food? Why is that important? Because it'll save you on your bill. You can that's another little conversation that I just don't think providers make that link for the woman enough times, and it's an important piece.
Great. Thank you very much for that. We're going to have to end our session here. We thank you all for this wonderful conversation and for the pearls that, that we're going to take from this. So thank you very much. And I will turn it over to Ann.
Thank you all very much. We have sandwiches and salads outside in the atrium, right outside the door, and there is also a cafeteria in the basement if someone needs to go down there for a meal. And we will reconvene then at 1 o'clock in this room.